Hi everyone, this is Dr. Mohan Sundaram. Today's topic is Erythema Nodosum. Guaranteed it will be very useful, especially for UG students. You can have a short notes on this and have a clinical knowledge. Something is better than nothing. So we'll move on to the topic. What is Erythema Nodosum? It is a localized, painful, inflammatory conditions of the skin. Common age group is 15 to 30 years. Mostly it affects women than men. So it may also be associated with pregnancy. So what are the causes of this etiology? There are many causes. We will see one by one. First thing is due to some microorganisms, histoplasmosis, streptococcus, tuberculosis, Yersinia, like that, etc. And it may also occur due to some drug reactions like amiodarone, antibiotics, oral contraceptives. It may also occur sulfa drugs due to drug reactions. Next thing one is it may also occur in chronic inflammatory conditions like Crohn's disease, ulcerative colitis, Behçet's disease, sarcoidosis, etc. You can clearly remember this very easily with this mnemonic. What is the mnemonic? Nodosum. So NO stands for idiopathic, no cause. Most of this occurs due to idiopathic reason. Next one is D. D stands for drug reactions. So already I have told some drug reactions like amiodarone, antibiotics. It may occur due to this. Then O stands for oral contraceptives. S stands for sarcoidosis. U stands for ulcerative colitis, and many other inflammatory conditions like Behçet's disease, Crohn's disease, like that, etc. The last one is M, due to some microorganisms. Already I have told some microorganisms may be due to Yersinia, streptococcus, tuberculosis, histoplasmosis, like that. So how the clinical presentation will be, what the patients will have clinically, we'll see that. It is a painful red subcutaneous nodules will be presented. So mostly it will be seen, the most commonest area affected is, you can see in the area of anterior tibial shins is the most commonest site. So the patient presents with low grade fever, malaise, with joint pains also. So this is the clinical picture. Usually it is self-limited. Within a week it will be resolved mostly. How you can diagnose erythema nodosum? You can go for a chest X-ray for ruling out the underlying diseases like sarcoidosis, tuberculosis. So you can go for blood tests. CBC, complete blood count, erythrocyte sedimentation rate, CRP, C-reactive protein. The inflammatory markers will be raised. So you can go for ASO titer, antiseptalizing O in streptococcal infections. Sometimes there may be false VDRL test positive, as in systemic lupus erythematosus, and if not at all, you can go for skin biopsy also. So then the treatment. First thing is you have to rule out the underlying cause in this, and you have to treat the underlying cause. The next thing is if the patient usually presents with what I told is low grade fever, body pain, malaise, and joint pains. So you can go for NSAIDs, analgesics. Rest is very important. Cool compressors. The limb elevation, lower limb should be elevated. So these are all the treatments. You can go for symptomatic treatment. As I told previously, it is a self-limiting disease. It resolves within a week or a couple of weeks. So the treatment lies like this. So this video is maybe very helpful, I think. Hope everyone enjoyed. Just leave a comment, like, subscribe my channel, Leave a comment. If any topics should be discussed, you can leave in the comment also. Thank you.